guys, so today we're going to learn all about macular degeneration. So by the end of this lesson, you'll have a better understanding of what macular degeneration is, the different types of macular degeneration, the assessment findings, treatment options, and the nursing considerations when you're taking care of patients with this condition. Okay, before going any further, I just wanted to make sure that we had a couple fundamental things down. Okay, so the retina is made up of photoreceptors and it transmits impulses to the optic nerve. This picture doesn't have the optic nerve, so we're just going to go ahead and draw him. This is the optic nerve, and the optic nerve is important because it helps transmit visual information from the retina to the brain. So let's go ahead and draw the brain. Here is our beautiful brain. Okay. Optic nerve. Okay. Alrighty. So the macula, on the other hand, is located right here. Macula. It's the central portion of the retina. It helps us focus central vision in the eye. The macula also controls our ability to do things like reading, driving, recognizes faces and colors, etc. It also allows our eyes to see things in fine detail. So any alterations in these structures directly impacts our vision. Okay, so macular degeneration in general is just a loss of central vision. So unlike cataracts, for example, cataracts are the overall visual field, overall blurring of the visual field. Cataracts is a loss of the central vision. So not the entire picture, it's the center of the picture. And this is caused by damage to the retina. This is the leading cause of vision loss, and there is no cure. Okay guys, so there are two different types of macular degeneration. One is atrophic or age-related or dry. So you could see this one referred to as any of these words. This one is more common and it's a gradual vision loss. This one's caused by blockage of retinal capillaries in the eye, which leads to the retinal cells in the macula becoming ischemic and necrotic, which then causes the rod and cone photoreceptors to die. On the other hand, exudative or wet macular degeneration is a sudden decrease in vision. So unlike dry macular degeneration, which is a gradual vision loss, exudative is sudden. So it's caused by the serous detachment of pigment epithelium in the macula. So once this happens, new blood vessels then invade the injured area and they leak. This causes fluid and blood to collect under the macula, kind of like a blister, which results in scar formation, visual distortion, and permanent injury. The deposits under the retina are called drusen or drusen bodies. Okay, so an easy way that I keep these apart, I think age-related as old. Old people can be dry, and their bodies atrophy as they age. Okay, so atrophic equals age-related. And then with exudative, I think of the definition of exudate. So exudate equals drainage, right? Okay, so exudative is wet because there's literally leaking blood vessels that cause the vision loss. Okay, so these pictures on the right, they do an awesome job of showing macular degeneration. The top is what you and I see when we see this picture, clear, crisp vision. With macular degeneration, they have a distortion in central vision. So you can see here, there's like that clear, crisp visual is gone, and really that central part of vision is distorted, it's gone, it's not present. So in dry macular degeneration, like we said, it's a gradual loss of central vision. It starts with mild blurring and distortion, and then it leads to the loss of all central vision. Wet is different because it's sudden and it's an acute decrease in vision. Now, both of these whether the onset is acute or gradual, it's both the loss of central vision. And both of these, since it's a loss of central vision, both of these patients, whether it's dry or wet macular degeneration, they'll have problems with simple day-to-day tasks that you and I take for granted, like reading, writing, recognizing safety hazards, etc. Okay, guys, so let's look at therapeutic management really quick. So for diagnosis, providers can use fluorescent angiography, and this is when patients are given dye, which helps identify circulation problems within the retina. Treatment with dry macular degeneration, there is none. So there's no cure. So really, our treatment and management is just based on slowing the progression of the disease. Wet macular degeneration is a little bit luckier. We are trying to slow the process as well, but there is laser therapy, which helps kind of zap those leaking blood vessels and kind of seal those up, and that helps limit the extent of the damage. Eye drops can also be given in wet macular degeneration, such as Lucentis, and this helps prevent the growth of new blood vessels in the retina. And something to just kind of keep in mind with wet macular degeneration, the fluid and blood can be reabsorbed by the body. So that's just something to keep in mind. So there are these other treatment modalities, but sometimes the body can kind of take care of some of that by itself. And management is really just, with both of them, it's aimed at maximizing the patient's remaining vision. It's also aimed at lifestyle modifications, so their vision is going to be altered, so we want to do things that are going to help with that vision alteration, such as providing large print education manuals and encouraging public transportation. Okay, so if your patient's on eye drops for macular degeneration, you'll want to be educating on how to administer those drops and the different side effects to monitor for, such as corneal edema and increased intraocular pressure. If the patient does have either of these findings, these are two things that we want to be reporting to the provider as they are abnormal. With both wet and dry macular degeneration, we want to be maximizing the patient's remaining vision. So the vision loss affects the patient's independence, well-being, and quality of life. So we want to be educating about different lifestyle modifications the patient can implement, like large print books, public transportation versus driving, and considering a meal delivery service, depending on the degree of visual impairment. Okay, so one of the nursing concepts related to macular degeneration is alterations in functional ability. So patients are not going to be able to see as well, which leads to them not being able to carry out their ADLs as they would be able to. Another nursing concept is alterations in sensory perception. Their vision is directly impacted, which directly impacts their senses and their ability to see. Okay, guys, so looking at the key points. So I want you to identify the differences between wet and dry macular degeneration. So let's go over those really quick. So wet equals exudative or leaking vessels. And then dry is age-related or atrophic. So old people can be dry and they atrophy as they age. So although there is no cure, there are eye drops and laser therapy that can be implemented with wet macular degeneration. Finally, management is centered around maximizing vision and helping the patient identify and implement lifestyle modifications as their vision suffers from this disease. Okay, guys, so that's it for our lesson on macular degeneration. Make sure to check out the other resources attached to this lesson. Now go out and be your best self today, and as always, happy nursing.